Bonjour, good morning. My name is Isadore. I'm the Ontario Regional Chief. I first of all want to acknowledge the shared Indigenous lands in the nations for which we're standing on today and are delivering this very important message. I want to also acknowledge the Neskantaga First Nation leadership and Chief Moonias, Deputy Grand Council Chief of Anishinaabe Nation, Terry Wabus, thank you for being here. I also want to acknowledge members of the media and thank you for coming out and helping us carry this very important message today. I want to thank the University of Toronto and the Wakabiness Bryce Institute for your efforts in this very important discourse of Indigenous health. I want to acknowledge Jeff Redding and Earl Nabagon and also acknowledge the work and the vision of Dr. Michael Dan. I do want to just, as the next speaker to the chief, I want to thank him for his very, very important message and the passion that he speaks about is one that is the most cause and concern for his people, the people in Neskantaga, those that cannot speak for themselves because they don't have access to this urban opportunity of being able to stand in front of the media. And again, we know there are many that the chief speaks for, so I want to thank the chief for that. There are some messages here that I just want to paint as the backdrop for what I'm going to deliver on behalf of the Chiefs of Ontario and Neskantaga First Nation. The first point is that access to clean drinking water is a human right enjoyed by everyone in Canada except First Nations. The second point, lack of clean drinking water in First Nation communities contributes to a quiet health crisis, destroying our communities and making our people sick. And in fact, this quiet health crisis is killing our people. The third point, the clean drinking water crisis is caused entirely by a lack of political will in Ottawa. And now we're seeing offloading to the province of Ontario as it pertains to regulations. So again, this is entirely an issue of political will. Fourth point, the next federal government must come to the table to make sure all First Nations have clean drinking water as soon as possible. And also too, I want to put an added note to that if the province is now somehow involved through affiliation and regulation, we need Ontario to stand shoulder to shoulder with all First Nations and Neskantaga, because there is a jurisdictional issue at play here. That jurisdictional issue has to do with regulations and having standards that the First Nations can employ in safe drinking water, but also too, there is the source of that raw water is under provincial jurisdiction. That's a very important aspect here. And we can no longer be subject to the issue of monkey in the middle here on a political ping pong match between Ontario and Canada. Each and every day, people in Toronto or Kenora or anywhere in any Canadian city or town, they can turn on their taps and have access to clean drinking water and they can shower safely. That is not the case for First Nations, sadly. Right now, over 40 First Nation communities in Ontario are under boil water advisories, and a handful of other communities are on do not consume advisories, meaning that they cannot use water at all without jeopardizing their health. And I think that's the situation that Neskantaga is in. When the people cannot even use that water to bathe, this is a human tragedy, and no commitment to fix this human health problem. First Nation people have worse health outcomes than most anyone else in Canada. Water is one of the key issues. The cost to the Canadian healthcare system and to communities are enormous, and that's because of poor planning and poor investment. It should be very concerning to Canadians that the federal government finds it acceptable for anyone in Canada to have third-rate health care based on their background. And what I mean by this is we must also point out very, very clearly that most people that are under this health condition of poor drinking water are also governed under the Indian Act. The Indian Act. I call on every federal party to recognize the quiet health crisis on reserves and to commit to every possible step to end that crisis. The Neskantaga First Nation are a community willing to stand up, and we at the Chiefs of Ontario are willing to stand up beside them. And we're calling on all Canadians, not just the federal parties, but all Canadians to make this a national dialogue. We can fix the clean drinking water and the health crisis. It is easier and better to fix it than to see this issue continue to destroy the health and well-being of our communities and their people. The federal government's decade-long underfunding of water services of First Nation reserves has created far too many emergency situations across this country. Neskantaga is just one of those. Far too many communities in this country are facing this. Canadians should be more focused on Neskantagas and not Niqabs. You know, just the other day we're seeing a debate nationally about whether or not somebody should wear a piece of clothing. Yet we have our First Nation communities that are dying because of the poor water conditions in their communities. That's the real issue, and that's why we're here standing shoulder to shoulder with the community. As a new national health portfolio holder at the AFN, my number one priority in months to follow the election is to work with the national chief to make sure that there is sufficient funding for all factors that influence the health of our First Nation people. That includes clean drinking water. Some of you will remember that over the last few weeks I have been using this word crisis, and it's not uncanny or a coincidence that the chief is now raising this crisis. This crisis has been going on for a long time, and we now need the media on our side to get that message out. Real action means reinvesting in the failed 2005 Colonial Accord commitments to improve health outcomes and ensuring that the next government invests the estimated $4.7 billion required to upgrade First Nations water systems across Canada. I've asked every federal party what they will do to solve the clean drinking water crisis. Sadly, the Conservative parties have not responded. We've not seen one MP from the Conservative Party respond to this issue. I will share the responses I have received from Mr. Trudeau and Mr. Mulcair on the Chiefs of Ontario website. These two parties have stated that they want to work with First Nations, that they want to be very direct in fixing the water crisis in our communities. So I share that with the community of Neskantaga and the Chief. I call on the next federal government to take solid, concrete steps to do more for our communities like Neskantaga and to show the world that it is not acceptable for Indigenous people to be second-class citizens. Miigwech.